Brazil's government says it got the message. More than 1 million people took to the streets in June to protest against corruption and abysmal services, especially public health. The solution? To revive a plan to import doctors. Foreign medics are headed to remote jungle towns and violent city slums to fill vacancies that Brazilian doctors have turned down. Residents say the help is sorely needed. It takes 3 or 4 months to see a doctor, or you have to go somewhere else, and it's a whole lot further, she says.
We've come to Cidade Leonor. It's really a classic favela on the outskirts of Sao Paulo, and there are only 2 doctors at the health clinic right over there, treating patients here, but also in the surrounding region.
Under the new program, the local clinic will get a 3rd medic from another country. People here hope foreigners will be more respectful than Brazilians. There are some who treat us well, she says, but others just write a prescription the minute we walk in the door. They won't actually examine us or our children. The program aims to place 10,000 doctors in Brazil's most needy regions. 4,000 will arrive from Cuba alone by year's end. The plan has its critics. Brazilian medics are now taking to the street to demand investment in shoddy infrastructure instead of monthly salaries of about $4,500 for each foreign doctor. Brazil's health minister says the anger is misplaced. We're not taking any jobs away from Brazilian doctors, he says. Foreign doctors will only take vacancies left by Brazilians. He points out Brazil has just 1.8 doctors per 1,000 inhabitants. That's compared with more than 6 in Cuba and 2.8 in the UK. The first wave of foreign medics has arrived for crash courses in Portuguese and unique local diseases. They argue patients should come before politics. In order to create a virtuous cycle of more infrastructure and more doctors, one has to come first, he says. If at this moment we don't have infrastructure, it should be the doctors who go in. For Freddy Barbeto, a Spanish doctor, it's also a needed job opportunity. A year ago, I was laid off along with 1,500 colleagues, he says. But for the 6 million Brazilians who don't have access to doctors, it's still just a drop in the bucket. Shasta Darlington, CNN, Sao Paulo.